Hi, my name is Emily Sutton, and I'm going to be presenting my Fear Multimedia project with you today. It's on nosophobia, and please excuse my very grainy camera. This is a 15-year-old Mac. So let's go ahead and get started. Let me share my screen with you, and I will get going. Okay.
You have started a screen share.
Play from start. Here we go. Okay, nosophobia, fear of disease by Emily Sutton, Dr. Serena Richards, English 1001, April 4th. So understanding nosophobia. So what is nosophobia? Nosophobia is fear of disease. And a lot of people get this confused with hypochondria. If you're lucky enough like me, you too can have nosophobia and hypochondria both. But there is a significant difference. And I think if people get a little confused. So nosophobia specifically is a fear of contracting a specific disease versus hypochondria, where we're just panicked all the time about any and everything, right? Despite any type of evidence or any specific illness. Nosophobia is more fear-based off of disease, right? So think maybe multiple sclerosis or ALS. I've got a girlfriend who's like petrified of getting ALS, and I too can relate. So they feel isolated, episodes of fear, panic triggered by the mention of this particular illness. Versus fear all the time with hypochondria, not necessarily related to a specific illness. They don't have nosophobia symptoms. Obviously, they don't have any symptoms at all, but they tend to, again, continue to worry about being diagnosed with a specific disease state. Hypochondria is just constant worry about little minor symptoms, right? The littlest things can trigger someone with hypochondria. Again, nosophobia is really focused on the disease specific things. Nosophobia folks, they tend to avoid thinking about the feared illness and avoid people and places associated with it, right? So if it's a disease like again a COVID, they're going to avoid going to the supermarket or being around anybody, right? I'm sure we all experience someone with a significant some type of form of nosophobia at some point with COVID-19. Everyone was petrified, right? But someone with hypochondria, maybe they tend to obsess over illness in generality, right? Versus just, a specific disease. And they are constantly worried about health in general versus nosophobia, again, not to be redundant, but again, focusing on the disease specific things. So that's the significant difference, but people do get those confused. So I want to make sure that we discuss that. So common symptoms. So what does someone with nosophobia have? So obviously, your first initial reaction is going to think physical symptoms, behavioral symptoms, and psychological symptoms. So the behavioral symptoms that someone with nosophobia would have would frequent self-examination, right? For example, ALS. Am I losing, feeling in my leg? Are my legs going limp? Am I losing type of muscle mass, etc.? Avoiding places associated with illnesses, like I mentioned before. Going out. Again, COVID is a great example of that. Repeatedly, seeking medical reassurance. So going to their provider, and again, obsessively asking if this particular symptom is associated with said disease state, and obviously ruling out specific things. Obsessively researching health information, so they're on Google. Right. Again, we all have somebody who probably has nosophobia who, again, their elbow hurts and now they're self-diagnosing themselves with cancer, right? Everybody can relate to that. I am one of those people. So physical symptoms, again, very similar to like anxiety, panic attack symptoms that someone with nosophobia will have. Rapid heartbeat, sweating, trembling, nausea. A lot of people again, put themselves in the hospital whenever they have nosophobia, just because, again, it operates very similar to maybe like a heart attack, but a lot of it is just associated with anxiety and panic of them getting the disease, right, that they're obsessed about. And then psychological symptoms, constant worrying about their health, difficulty concentrating because all they can think about is getting this specific disease, irritability, and of course, fear of dying from the disease specifically. Okay, why are you not going? Please hold. I don't know why my screen is not wanting to go to the next slide. Okay, causes of nosophobia. So how in the world do we get nosophobia? Or how does someone get this. Several of the key factors that the research has brought to light on people that have had this disease is being seriously ill as a child, family history of maybe a specific disease, and so in their mind, whether it be probably more of a subconscious thing, they're thinking they're going to ultimately end up with this disease, right? Think of somebody with, again, a family history of cancer, right? They're going, or breast cancer. Obviously they're going to continue to panic. Anything that is maybe related to specific cancer that their family may have had, they're going to probably be symptomatic, right? Or maybe panic because of it. Caring for a loved one with a serious illness. This is a big one. This is more than likely where mine came from. Growing up, my grandmother was very ill, and she constantly was worrying about dying, and she had a lot of health problems. So I think she gave this to me ultimately. So I think that is a big one. Someone who is just around someone with those similar traits, and just ultimately just constantly worrying, moving forward from it. So loss of a loved one due to an incurable disease. So again, if you have anybody that you've lost with cancer or whatever, it's obviously going to be impactful to you as far as just obsessing over it maybe. Growing up with a parent who has illness, anxiety disorder, again, often sometimes called hypochondria, right? Everybody knows the hypochondriac, right? Phobias or anxiety disorders. So again, very similar to me growing up with my grandmother, and it, obviously rubbing off on me, very similar to a parent or someone that they, grow up close with. Gene changes, so mutations that increase your risk of an anxiety disorder. So obviously anxiety goes hand in hand with nosophobia. Okay, so who is most vulnerable? So a lot of the research that I found is healthcare professionals, which I thought was interesting because a lot of the times they're so, I wouldn't think that they would be. Maybe COVID-19, because again, they were around it so much, but they're so knowledgeable in a lot of these disease states that I wouldn't think that most healthcare professionals, like nurses, again, nurse practitioners, doctors, I wouldn't think that they would have this, right? Because again, they've just, been around it, and they know, specific things about these disease states that ultimately they could probably just rule out themselves. But I thought that was interesting. Again, like I mentioned, growing up with the childhood illness, media consumers, right? COVID-19 was a perfect example of that. My mother-in-law was just fixated on, the media attention that COVID-19, rightfully so. But she was just a crazy person. She was panic stricken. She could barely sleep. She was just, ate up with anxiety over COVID-19 specifically. But I think a lot of that was fueled by the media and her watching the news and stuff obsessively. Trauma survivors. And then family history of anxiety disorders, like I mentioned before. Okay, so how nosophobia influences our communities and their decisions. So this is a big one. So mental health is a big one here. So heightened fear of diseases can contribute to anxiety, stress within communities. For example, the protracted duration of the pandemic posed a threat to mental health. So we did see an uptick and rise and obviously struggle with mental health, not just from a disease perspective, but also, we were stuck in the house and people were going bananas. And I think it was several different variables that were contributing to this, but it had a severe impact. Social stigma. I think that anxiety disorders, disease states like a nosophobia get a bad rap. They may result in stigma towards those who are perceived as ill or have a chronic illness. Stigma often comes from lack of understanding or fear, and this can isolate individuals, making it difficult to find support. There is a social stigma surrounding nosophobia, hypochondria, anxiety disorders altogether. So that is certainly influencing the community and kind of how they handle nosophobia. Public health behavior. So the fear related to COVID-19 and other diseases associated with nosophobia, health anxiety among people, and especially medical professionals, had a substantial impact on health, work performance, vulnerability to developing psychological distress if left unmonitored. So again, whenever you have this, it is significantly impactful on your quality of life, right? And I think that it's not talked about enough when people have this, because it is truly impactful. And again, like I said, their quality of life is severely impacted. It can affect relationships, jobs, again, the their kids, how they're going about their week, their day. It's certainly impactful for them. Okay, so how nosophobia prohibits progress. So severe anxiety and not getting help. Many people with nosophobia and other specific phobias are likely to avoid seeking professional advice. And part of this, it sounds, it's a little ironic. They won't seek help because they're terrified of getting a diagnosis about a specific disease state, which makes complete sense. So it just kind of depends upon the person, but that would certainly prohibit somebody from seeking any type of help with this. Disruption of daily life. So phobias, like anosophobia, can cause physical, mental, and emotional responses. They can also affect how you act at work, school, or in social situations. Again, like I mentioned before, it's significantly impactful on a day-to-day basis if they have nosophobia. Stigmatism and discrimination, like I mentioned before, stigma characterized by social prejudice and discrimination profoundly influences psychiatric care, creating barriers to timely recognition and treatment of mental health disorders. So I think the stigma that we place on things like nosophobia, hypochondria, and anxiety, again, like I mentioned, it gets a bad rap. So your providers will downplay it, right? I've actually personally experienced that myself. Oh, it's just your anxiety acting out, or you're being a hypochondriac, you're being overreactive. So it gets downplayed quite a bit. And I think, psychological from a psychologist perspective, it probably does get downplayed a lot too. And it's used as more of an excuse stick to you overreacting, right? When it would be anything else. So I think that is impactful as well. Misinformation. So false information being spread via social media and the news can make it impossible to overcome. So if you're constantly, again, I'll take my ALS example. If I'm constantly on Facebook or Instagram or TikTok and I'm constantly seeing people with ALS, I'm going to continue to put myself in a panic about getting a specific disease state, right? Or cancer or whatever it is, right? COVID. If it never goes away, then you're going to constantly be in a state of panic about it because you just can't escape it. And then inadequate, healthcare coverage. If you can't afford it, you're not going to seek help, right? I know a lot of people struggle with this. I will go off on a tyrant about it. But anyway, we're not going to go down that rabbit hole. But the cost associated with getting treatment and getting help prevents them from getting the necessary things that they need, whether it be psychological help, which I think a lot of this is deeply rooted in trauma, and psychologists, obviously is going to be very, very helpful, but also ruling out any true health concerns and issues from a healthcare perspective is also going to help as well. Put their mind at ease and, have them a little bit more relaxed. So that way moving forward, they're not going to be constantly in a state of panic about a specific disease state. Treatment approaches. So how in the world do we fix this? So some of the recommended treatment approaches is cognitive behavioral therapy. So it's called CBT, helps identify and challenge negative thoughts, patterns, and health. So a lot of this is, again, working with, a psychiatrist and really taking a deeper dive and peeling that onion back to say, okay, what are the causes? What's the root cause of why I'm having these symptoms? And then tackle that, right? I think if you approach it head on and you don't just pretend like it doesn't exist because of the stigma that's surrounded with it, or whatever other things are coming up that may prevent them from getting treatment, I think is important. Exposure therapy, so gradually exposing yourself to the health-related fears to reduce anxiety. I know it sounds counterintuitive, doesn't sound like it makes a whole lot of sense to do exposure therapy, but it truly does help. And then obviously relaxation techniques, right? Anyone with high anxiety more than likely has nosophobia, so that is a contributing factor. So deep breathing, muscle relaxation, managing your physical symptoms so you don't spiral and put yourself in a panic attack because you saw someone with a specific disease and now you're convinced yourself that you have it, right? And then additional self-care treatments. So individuals who experience intense fear and anxiety, hello, can utilize self-care techniques. Some of these work, some of these are just, again, something that we're recommending. Maybe they'll work for other people. Relaxation techniques, easier said than done. I also have a 4-year-old, so that doesn't work for me. Breathing techniques, yoga, meditation. I actually haven't tried this one. Utilizing a sleep schedule. What's a sleep schedule? Avoiding caffeine, alcohol, illicit substances. Please don't do drugs. Regularly exercising, communicating with supportive friends and family. This is a big help because they'll tell you you're crazy and you're overreacting, which is a little helpful. My sister is also a nurse practitioner, so I lean into her a lot. But this is truly stuff that certainly helps just to get validation that it's just your mind, playing tricks on you. And then attending support groups. I think would be very helpful, especially with the stigma that is tied to nosophobia, hypochondria, anxiety. I think just being around people that can relate to you and have the same symptoms as you do, I think would be helpful just to work through those in a group setting or one-on-one, whatever it may be. And then living with nosophobia. So again, seeking professional help, consulting the healthcare providers, again, like I mentioned before, to rule out truly that nothing is wrong with you. Because again, a lot of the times this does get downplayed and they brush the symptoms off. And sometimes, I won't want to say a lot of the times, sometimes it does turn out to be something of concern, right, from a health perspective. So it's important just to rule everything out. And again, it will help to put your mind at ease. And then finding balance. So taking your reasonable healthcare precautions without excessive worry. So, not going to the doctor every single time you have a baby symptom, because again, that can fuel the panic. And then practicing self-compassion. So recognizing that recovery takes time and effort. I don't think we give ourselves, anyone with a phobia in general, I don't think we give ourselves enough grace. And I think that is very, very important in the healing process. For sure. Okay, and then we're excited. That is all she wrote. That's all I got. Thank you so much and have a great day.